Hello and welcome to 5 Minute Pharmacology. Today we're going to be talking about the drug magnesium sulfate. Mag sulfate does not have a trade name and is classified as an electrolyte or tocolytic. Tocolytics are a classification of a drug that delays the labor process. Mag sulfate is carried 1 gram in 2 mLs, and we currently carry 6 vials of this medication in our drug box. The pharmacology and actions behind mag sulfate is it acts as a smooth muscle relaxant. It decreases early after depolarizations and reduces arrhythmias. It decreases seizures and eclampsia and preeclampsia, possibly via cerebral vasodilation. And it is a CNS depressant. So mag sulfate is an electrolyte, but remember that it does have an extremely effective It is an effective antiarrhythmic agent. Specifically, we use this for torsades de pointes, and the mechanisms of how and why it works to terminate these rhythms isn't fully understood. Um, but they theorize it may have an effect on the sodium channels by blocking those. So some other indications in which we give this drug is eclampsia, preeclampsia, torsades, which we just talked about, and severe bronchospasm in patients with asthma or COPD, um, where mag sulfate has its smooth muscle relaxant effects, and that may help open up those airways. And for the eclampsia and preeclamptic patient, this is one of the very few drugs, or if only drug, that we give prophylactically to treat that. So we'll talk about that in a little bit. Some absolute contraindications is a magnesium allergy, and some precautions and side effects is it may cause hypotension and respiratory depression when we're giving this in large doses, and we should use this in caution with patients with renal insufficiency or chronic renal failure or dialysis. And so, um, going back to some of the guidelines in when we would give this, we can start off with the very bottom at OB, gynecological emergencies. So for our preeclamptic patients, so these are patients that are not seizing yet, but it says pregnant seizures greater than 20 weeks should be assumed to have eclampsia. We can give um, we can give magnesium sulfate for preeclampsia before the seizure happens at 4 grams IVIO over 10 to 15 minutes. Um, mag sulfate has been shown to help increase that seizure threshold, and it may actually in turn lower the blood pressure and help prevent the risk of a couple things that can be involved with all these signs and symptoms, such as like placental abruption, the patient becoming actually eclamptic and seizing, and maternal cerebral hemorrhaging that can occur. So if we notice these signs, and I would encourage you to go back and read through your protocol, your OB, gynecological conditions, and look at all of those signs and symptoms of preeclampsia. And if you do recognize these in the patients greater than 20 weeks or even 6 weeks postpartum, we need to think about giving these medications or giving mag sulfate. So if the patient is seizing, we can give, or in an eclamptic state, we can give mag sulfate at 5 grams over 5 to 10 minutes. If not responsive, we can give our benzodiazepines as well. So, um, even if you decided to opt to give a benzodiazepine, and then let's just say you found out the patient was pregnant, just remember after you gave that benzo, now you can go ahead and just give the mag sulfate that way. So, um, tachycardia with a pulse. So with patients who are in stable torsades, we can give mag sulfate at 2 grams IVIO over 5 to 10 minutes. For bronchospasms with severe respiratory distress, that is not a that isn't corrected by um, our beta 2 agonists. We can go ahead and hang mag at 50 milligrams per kilogram, and we're going to hang that over 5 to 10 minutes to a maximum of 2 grams. For seizures greater than 20 weeks, we've already talked that, or up to 6 weeks postpartum. Cardiac arrest. Um, for cardiac arrest, we can give it for torsades at 50 milligrams per kilogram IVIO to a max of 2 grams over 5 minutes. Um, but that's it. This drug, MAG, is very versatile. It's not only used to, stop seizures, it's used to open up airways, to an antiarrhythmic, So it does lots of things. Um, and I hope you learned something about mag sulfate today. Thank you for listening. Just make sure you like and subscribe. Thank you. Have a good day.